In February 2020, we began to see the impact of COVID-19 on our residents, and our service began to experience an increase in demand. This particularly related to job losses due to the international impact on Gatwick Airport in Crawley. By March 2020, we were forced to close our outreaches in many of the centres due to COVID-19 restrictions. We had to change the way we gave advice as we responded to the emerging needs and impact of the pandemic. Our charity had a rapid transformation to digital delivery, and within 2 weeks of lockdown, 100 volunteers were providing advice at home. We were able to introduce new ways of communicating with residents, with video chat and British Sign Language access, and kept 3 of our offices open so vulnerable residents had somewhere to go. As well as providing advice, over 250 hours of training was delivered online to our team. And during this time, we didn't miss a single hour of service delivery. Being able to take a proactive approach to sharing information and advice was one of our biggest achievements. We used a strategy to get information out to the public as quickly as possible so that they had the facts and knew what to do, freeing up resources for those residents who needed an extra bit of help. We are extremely proud of our staff and volunteers who embrace change to meet the needs of residents with flexibility, determination, and empathy. With 1,000 people visiting our offices in person, needing help with domestic abuse, illegal evictions, and who were digitally excluded, we delivered mobile phones, fuel vouchers, and collected benefit forms to keep everyone safe. In partnership with Arran and Chichester Citizens Advice, we provided much needed extra support with utilities and warmth throughout the coldest period, successfully delivering $250,000 in winter grants across West Sussex. And at the same time, we were offering advice through our digital channels, which is why in 2020 to 2021, we helped 28,648 people with almost 90,000 problems, from debt, benefits, housing, and employment.
What Elizabeth has done for me is absolutely beyond anything. It's all been such a whirlwind. Not being able to work, I had car loans, mortgage bills, and I was getting virtually nothing, and that completely stressed me out beyond belief. When the hospital said you realise that you can get financial help through Macmillan and Citizens Advice, that's when they put me through to Elizabeth, and I had no idea that even existed. I wouldn't have known where to start with my mortgage or anything. I was honestly at my wit's end, and I thought I was going to have to sell my house and maybe live in sheltered accommodation. That's how bad it got, because I just couldn't see where I could get this money. That is what was really getting to me, because I thought I was going to have to go back to work, and everyone was saying, "You can't, you're not fit." What worried me was that if I went too early, I'm going to end up with cancer again. You just don't know. Seriously, without Elizabeth, I don't know what I would have done. She was kind and considerate and listened to my needs. She did everything to support me, and she couldn't do enough. She went through everything once I told her my financial mess, with PIP, with Universal Credit, and put me onto someone to help with my mortgage. Everything she suggested on the financial side, I wouldn't even have a clue. It was degrading having to ask the government to help, but I wasn't mentally ready to go back to work. I was a mess. To anyone that is going through cancer, it's never too late, and you should never be too frightened to ask for help. I honestly didn't think I would have been able to, and I shied away from it. I thought, how can I ask for help? I thought I'd never be eligible for anything. Someone who has worked their whole life, I thought I was unlikely to get anything. That's the way I looked at it. To get some financial help is a life changer.
As demand increased, we invested more into our staff, volunteers, and technology to put us in the best position to be able to meet these challenges. We were able to take opportunities created during the pandemic to grow our funding and expand the services we offer. This includes the Trussell Trust Food Bank Helpline, debt web chat, and preventative money advice for communities facing the disparity of COVID-19. Being a part of the community response to the pandemic included projects targeted at reducing inequalities caused or made worse by COVID-19. We help people to access emergency food and energy vouchers, money advice for suicide risks, as well as advising on furlough. In this time, we were able to develop our community engagement to help ensure the voices of Black, Asian, and residents from other ethnic backgrounds were heard and services were put in place. This included partnering with Mid Sussex District Council to support our diverse communities and developing community champions in the Mid Sussex area. And by working closely with our communities, we were able to gather insight on how COVID-19 was affecting them. This insight could then be shared with the NHS and local authorities to help reduce these inequalities, as well as sharing with our new champion connections who could pass it on to their community network. We were able to respond to the pandemic by supporting our partners in targeting resources so the most vulnerable were supported. We were also able to increase our work with people at risk of suicide. This includes piloting support at Langley Green Mental Health Hospital. Having sped up our digital transformation, today we are now working in a more flexible way to meet the needs of our residents, using blended channels including digital platforms, reopening our outreaches, and increasing in-person contact in our offices. Our transformation and growth has seen us adapt to the needs of our residents and help more people get the support they need, as we strive for West Sussex communities to thrive. For updates on what we're getting up to, check out our website and find all the ways you can get in contact with us. You can also connect with us on all major social media platforms.